Hello and welcome to the NICU Space podcast by Miracle Moon. I'm Dr. Frankie Harrison, a clinical psychologist and NICU parent myself. Through my work as a psychologist and through my own experience of having a baby in neonatal care, I know that the NICU journey can leave a huge emotional impact on parents and families. This podcast is a space where we talk honestly about that experience. We will be exploring the emotional impact of neonatal care, the anxiety, the guilt, the grief, the questions about bonding and identity, the parts of the experience that so many parents carry long after leaving the hospital. Across the series, I'll be speaking with other NICU parents at different stages of their journey, as well as professionals working in the field. We want you to feel seen, understood, and less alone in what you've been through. So whether you are currently sitting beside an incubator, recently home from NICU, years down the line still making sense of it all, or someone supporting a NICU family, you are very welcome here. What you have been through matters, and you do not have to carry it on your own. Before we begin, just a quick note that this podcast is for information and support, but it is not a substitute for individual medical or psychological care. Now, let's get into today's episode. Hello, and welcome to the NICU Space podcast. Today, we are talking to Mary Jenner. So Mary is a nurse turned entrepreneur and systems change advocate, that is a mouthful, who is on a mission to eliminate preventable medical trauma in children. She is the founder of the Butterfly Pig. So you can find her on Instagram, the Butterfly Pig. And that's a company that creates realistic, inclusive medical play tools that help kids and families understand, process, and feel safer during medical experiences. Her products are used by over 20,000 families and in over 140 hospitals across the world, and they ship worldwide. Mary is also the visionary behind the Innovative Care Institute and the Thrive Network, which is a model designed to empower frontline staff in leading change around trauma reduction and sharing learnings across hospital systems worldwide as well. So in this episode, we talk about how to support NICU siblings, how to talk to them about what is happening in the NICU. We also talk about how to recognize and reduce medical trauma for our children and how to prepare them for interventions or procedures, no matter what their age. We also talk about how we can use play to help them process and make sense of things, and how representation is really important as well. So I'm really excited for you guys to listen to this episode. I think it will be really informative, and especially for those people who have their children who have a lot of medical procedures, who go to hospital a lot. I feel like this is a really important conversation, how we can be supporting our children, helping them to make sense of it, and supporting them in that space as well. So let's get into this episode. Hello, Mary. Nice to have you with us.
Thank you for having me on.
No, I'm really, really excited to talk to you. I think this is going to be a really, really useful conversation for people. And I know that it was something that I definitely have found myself Googling in various different ways with my kids about how to support them around medical appointments and all of those kind of things. So I'm really, really glad that we've got you here today. So thank you.
Yeah, I'm excited to talk more about it and share about what we're doing.
Amazing. So before we get into it, we've had quite a few questions through, as I said to you before we started. But before we get into it, can you just tell us a little bit about you, a bit about your background, and a bit about how you support families?
So I'm a nurse by background, and I started my career in peds oncology, and that's where I saw the need for more tools to teach our kids through the way they learn best, like hands-on play, but also to help them process their experiences, because kids, they like to play out their reality, and kids that are immersed in the medical system deserve to have tools that reflect their reality as well. So it wasn't till years later, mid-pandemic on maternity leave, that I actually started dabbling into it and making toys. And so now we have over 100 different medical toys that are all made to look like real equipment. And in 4 years in, I ended up having a baby in the NICU, and I got to see the power of those toys for her older sibling. So It's just, I've been able to see these toys from all different lenses, and it's been a really neat experience.
Would you feel okay talking to us a little bit about that experience of
absolutely.
the NICU? Yeah, and because I know that there will be so many people who are listening here and have siblings at home, so have that very same experience, then are thinking about, like, how do I support a sibling at home to make sense of everything that is going on. So I'd love to hear a bit more about that, if that's okay.
Yeah, absolutely. I'm an open book, and like how I like process trauma is talking about it. And like
Yeah.
I overshare. And then like my husband on the other hand hears I'm gonna be on like a NICU podcast, and he's like, yeah, I'm not gonna listen to that episode. I don't want to relive that.
No, me too. I'm absolutely. I've made a whole page about it, haven't I? So it's definitely a way of processing it. So tell us a little bit about the experience of the NICU part for you, if that feels okay. Yeah.
Yeah. So I had a full term, quote, normal pregnancy. I had a C-section with my first, and then there were 4.5 years between. So
Okay.
we thought it was enough time to do a trial of labor and do vaginal birth for my second. In retrospect, I have some healing skin autoimmune things that we
Right.
weren't really considering. And my uterus ended up rupturing partially during birth, but we did not know that had happened. So during labor, I had a low dose epidural, but I was still having some pain, and there were just some like non-specific things happening. And by the time she came out, they realized that my placenta had abrupted because she was unresponsive, and there's blood. I don't know if we want to like say that in the podcast, but she was unresponsive, and it wasn't until 6 hours later that I was in so much pain, and they finally did a CT and realized that like my uterus ruptured partially, and that's what caused it.
Yeah.
So she was immediately taken up to the NICU for cooling therapy. So she did hypothermic cooling for 3 days, and in that, gosh, when they're doing the cooling, they have the continuous EEG. She had a CPAP, and she had all the things happening, and she ended up being in there for about 16 days, ultimately just trying to learn how to eat on her own and have enough stamina in order to get home.
Yeah, completely. And then you had another child at home. Did you say four?
Yeah, she was 4.5. Gosh, since we already had the business, she was exposed to medical devices in toy form for the years leading up to it.
Wow.
So it was really interesting because when my daughter was in the NICU and it was time to bring Josie in to meet her, I was not in a great place mentally. I was depressed. I felt like I was barely surviving, like trying to get through the day. So like, I didn't feel like preparing her, and I just assumed she was going to be kind of scared like everyone else. Like all the adults coming in, as soon as they saw Heidi, it was just like, oh, like a really solemn, this is scary. Like what is going to happen? We didn't even know if she'd survive even on those first few days. It's really up in the air. So then when we brought Josie in, I just remember her being so excited going, Mom, that's a CPAP. We have that toy.
Oh, wow.
And I was probably the only 4-year-old in the history to come in knowing the word CPAP off the bat. So it was really cool because she immediately was reassuring Heidi, and she said, Heidi, as soon as you get these products off, she called them products. That's what we called them at the office. As soon as you get these products off, you'll come home. But if you have to come home with them, that's okay too. Mom will make you a toy, right, Mom? And I just remember sitting there, what? How are you like handling this? Wow, this is amazing. And it made me feel better because I was like, I hate to say it, but I was distancing myself from my youngest, almost as scared of it getting attached in a way. Like it's really weird to reflect on that. And seeing Josie come in with this fearless love for her sister. I don't care what's happening or what the what ifs are. You're my sister and I love you. And it changed the whole experience for me. So I'm so grateful for my older daughter.
Oh, no, I love that. What a story. I think that just kind of is slowing down a bit, that because I know that a lot of people will be listening to this and will go, I felt that too, that keeping them at a little bit of a distance, not getting too attached just in case something happens. I think that's such a common feeling. But I think that maybe by doing something like having to talk to their sibling about what's going on, or using that kind of play or all of that kind of stuff, it stops you from being able to do that almost, know, like, it brings them into your world and it makes it a reality of what's going on. It's connecting when you do that.
Yeah, and I remember, so we didn't know her gender when we were waiting until birth. And so I remember throughout the last few weeks of pregnancy, I picked out, if it's a boy, I'm going to buy this pajama set for for the siblings to match. And if it's a girl, I'll buy this pajama set. So then I remember in the first few hours after birth, I hadn't even seen my daughter yet. And and I remember feeling hesitant. Do I buy the pajamas if I don't know if she's going to live? It's so weird when you're faced with such a very serious thing. You think of these superficial things. Like, why did that even matter?
Completely that. No, I completely get that. Yeah.
And then it was like, I think maybe it was the next day. I was like, no, I'm buying these pajamas. She's going to live, or we're going to do this. And it was like such a big moment buying the pajamas for some reason.
Yeah, totally. And I guess that's like the pre-version of you that didn't know that this was coming. And like that thought process was important to you. Like it's an expectation of what this is going to look like, right? And then this happens and it's like, this is not what we had planned. This was not the expectation. So it's still like, how does that old thinking fit?
Right. Yes.
With this experience now.
Why did I care about pajamas?
Yeah, absolutely, for sure. So Josie was kind of like aware of the medical equipment. She had names for it already. So it's maybe different to the majority of other children in terms of being able to have the names for it. Can I ask if people have got siblings at home and they're trying to explain to them about the NICU or about what's going on, do you have any tips or anything that could help people in having those conversations?
Yeah, it's for kids, there's a lot of studies that show that most medical fear and anxiety is due to the unfamiliarity and like all this equipment and just not being familiar with it. So there's so much power in preparing them what they're going to walk in and see, because if you look at a setup of a NICU baby, it looks like a lot. So just coming into this unknown environment, seeing your baby sibling and however your parents may be acting, it's all very different and unknown. So there's a lot of power in that preparation. And you could look up photos online to prepare them. There is something about the real equipment that still isn't as child friendly, where if you look at toys, like we have a mock-up video we did of what my daughter went through in the NICU with the cooling blanket and everything. And the toys there's a little more emotional distance. So like when the kids see what to expect in toy form, it's inviting them to the conversation. They're like, oh, I'm familiar with toys. I know how to play. So even with our looking up our toys on the butterfly pig and showing different videos on our social accounts of what maybe to expect when they walk into the NICU, that is something that can even help prepare them. Because just getting them comfortable with what they're going to see is so powerful before they actually come into the environment.
Yeah, completely. Do you know, as you were talking there, my brain automatically went to, and do you know what? We don't do that for parents either. But, like that kind of power in preparation, like I just think across the board is really very important. But I guess for a child, that play aspect to it, it's how they do life, that kind of language, right? To be able to make sense of stuff and how they process. Is there anything that you can talk to about that, about how kids do process through play? Like how does play help them to be able to make sense of that stuff?
So play is often talked about as like the language of a child, and play has access to like implicit memories, like the memories that we don't even have episodic visual memories to it, but the memories that live in the body, and it has access to the subconscious. Like it is such a powerful tool, but there's so many different levels of play that you can look at, because there's free play. If you just give a child access to medical toys of things that they've seen in the hospital on themselves or family members, then they can just play out whatever's comfortable with them. Then they're in charge of if they want to play with it, when they want to play with it, how they play with it. And as a parent, like you don't need to correct them if they put like a stethoscope around their belly. Like that's just how they're playing with it. So however they want to play with it, there's power in that. And then you can go further in getting in expertise of a play specialist or child life specialist, where they actually can observe how a child's playing and guide them in different ways and figure out a specific plan, or play therapist where they can help heal emotional harm and trauma through play. There's so much power in play, no matter how it's used. And so as parents, I think it's really powerful just giving kids access to play like that, just so they can do it on their own.
Yeah, completely. And I guess there will be differences in age with that. Is there an age where you wouldn't use those kind of toys, or would you use it with any?
I would use it with any. Like for our medical toys, for example, of course, like we say, they're choking hazards. Like you don't want to give it to a child unsupervised under 3. But my daughter, who's 2, I still let her play with them supervised. And it's really interesting because our littlest children, in order to map a toy onto a real experience, it has to look quite realistic. Because if you're looking at a Minnie Mouse doctor set, like that's not, they're not really going to see that as like their experience at the doctor. But when they see the real equipment, like when my nephew, he has HLHS, and he has had multiple surgeries, and we made the chest tube drain in toy form for him. Right. And he was quite young, but it looked almost exactly like it. So it just, when he had his own, it was, like that, my dino has that. It was just like such a matter of fact thing. And it's nothing that like anybody had to explain. He just knew because it was visual and hands-on, and he was playing with it already.
Yeah, completely. So is there an aspect of explaining what happens, for example, in that situation with your nephew, like with what is going to happen and how it's going to happen, to help them kind of prepare? Is that part of it?
Yes, absolutely. It's the kids deserve to be involved and to be prepared and educated on what is going to happen. And often I think that there's myths that like if you prepare a child or tell them what to expect, that they're going to be more scared. But really it's the other way around. If they aren't expecting it and something happens and you've lost trust, like then it just increases their trauma and fear, and then it just compounds time after time. So really we want to do our best to be honest and explain to kids what is going to happen in an age appropriate way.
Yeah, completely. And I guess that's about being clear, matter of fact, like I can't figure out what the word is with it, but like that kind of like plain speaking, explaining what's kind of happening. Yeah,
exactly. Yeah, you don't want to be too fluffy in
yes,
in trying to say. I think sometimes when we talk to kids, you try to talk more simply, but then you can go too far and then be like, "Oh, does your tummy have butterflies in it?" And it's they're like, "What?"
Yeah,
like you're very completely literal.
Yeah, absolutely. I've had both recently where we were talking about a sickness bug. And they were both like, I have a bug in me. I was like, no, like you don't realize with that language until actually they kind of, you figure out what their brains are thinking around it as well.
Yeah. And there's if parents are wondering too, like how to talk about things, there are some like phenomenal guides and things on the internet out there.
Okay.
There's child life specialists that make books about it. And there's some really cool things. A lot of our products come with a guide that's made by a certified child life specialist that says, for this age, this is how you talk about this procedure. So I know it can be easy to say, talk about it in an age appropriate way, but you're like, what does that mean? But there's resources. You're not alone.
Did you know that the NICU Space is more than just this podcast? We also run an online community created specifically for NICU parents. Whether your baby is currently in neonatal care or your NICU experience happened months or even years ago. Inside the community, you'll find specialist guidance from professionals who understand NICU, resources and coping tools to help with the emotional impact, and most importantly, connection with other parents who really get it. For many parents, it becomes a place where they can finally talk about their NICU experience with people who understand without needing an explanation. If this sounds like something that would support you, you can find out more information in the show notes. Let's get back to the episode. Okay. Okay. That's really good to know. So are there things that people can access through your page? I'm thinking about
Yes.
people who are in the UK as well. So
Yeah,
yeah.
absolutely. Yeah, we have
Okay.
those tools. There's even a free app that we have on the App
Okay.
Store. It's only on Apple right now, but it's called Playful Prescriptions.
Okay.
And you can put in your child's age and whether it's a diagnosis or something about the body you want to explain, like the circulatory system, or you can
Uh-huh.
type in whatever and it'll pop out some age appropriate ways to play with them and help them understand those different concepts.
That's incredible. Wow, what a resource. That's so helpful. I'm
Yeah.
wondering if we can kind of go into a couple of the questions that we've got through from people,
Yeah.
because I think that a lot of these questions will be helpful for people to hear. I guess what you talk about a lot is thinking about how we can be preventing trauma, how we can be supporting people through, or children through kind of medical procedures, how we can use play, all of that kind of thing. How would you tell if your child was struggling, traumatized by those kind of medical experiences that they had already had?
Yeah, that's a really good question and one that I myself am asking when I'm looking at my own kids, like wondering the
Okay.
times I've had to hold them down, if they remember it and if their body remembers it. And sometimes we don't know. Like even our own as an adult, I don't even recognize something's traumatic until years later when
Yeah.
something I see it on a TV show, like an episode of The Pit I just watched, and it's just like, whoa, like
Mm.
you feel it in your body and you didn't even realize that you had that. So I think sometimes as parents, it's hard because we don't quite know exactly what's going on in our child's brain either. Sometimes there are signs, like if you have a child who's frequently in the hospital and they're really withdrawn and they're not saying no or not like they just look like they're kind of just accepting what's happening, like that could be a sign that maybe they like feel powerless or they've learned before that their voice doesn't matter. And there once that we're at that point, like there's of course like we want to look for like specialist help and helping heal some of that, but importantly just trying to reinforce that like their voice does matter and like bringing choice into things and like just letting them know that they're part of their care. Like we don't
Yeah.
want children to feel like care is just being done to them. We want to invite them into it.
Yeah, completely. If you've got a medical professional who's maybe not doing that,
Yeah.
is there a way that you can, as a parent, advocate for that? Or how would you manage that situation?
Absolutely. And this is the hard part because a lot of the work we're doing now is trying to help change the systems. Because the way that the
Mm.
healthcare system works right now is it trains healthcare professionals to move fast. And even when I was a nurse at the bedside, it was almost like you thought that being quick was compassion. Let me just get done really quick and we'll be done. But it's not. After we want to
Yeah.
slow down and take time to prepare and take time to take a breath. And so as a parent at the bedside, when you see that your nurse or doctor or somebody seems to be rushing through care, or you notice signs that they might be stressed and in survival mode, is what we talk about a lot,
Mm.
then it's okay to ask for a pause and advocate and say, hey, can we just take a few minutes to breathe here? In non-emergent scenarios, ask for a pause. And
Yeah.
that's something we're trying to get hospitals to even put up posters and have pamphlets, like encouraging parents to be able to ask for a pause. Because we've had countless people talk about like when there was one person, for example, saying that they were getting a vaccine as a child and they were having a ton of fear and they were screaming and they were going to hold them down. And the parents said, you know what, we'll come back another day. And then they left. They talked about it. She said when they came back, she was totally fine and got her vaccine because she was sitting in her dad's lap and she knew what was going to happen. And she was saying that just that simple going home, coming back another day was like everything. And I think
Yeah.
that's so important because even being a parent, you're like, no, we're here today for vaccines. We're going to get it done. And I was just there with my 2-year-old needing labs done the other week. And I was like, oh, we missed on the first try. And she's crying at this point. And I'm like, you know what? These aren't urgent. Let's come back another day. And
Okay.
it's hard because it's going to take more time, but it does
Yeah.
reduce the trauma.
Yeah, completely. So being able to know that there is an out,
that if there's distress there, that you are able to take a pause or leave if you're able to, in that kind of way, right?
Yeah.
If your kid is, so we've talked a little bit about maybe if they do a bit of the shutdown. So we may be seeing that they're like overly compliant or shutting down a little bit. But I guess maybe the other side that you would see is heightened distress around being in hospitals, medical procedures, and especially maybe with children who've had quite a lot of that. I guess that is more common, that there may be like higher distress around it. So we've spoken about how we can prepare them, how we can create pause, all that kind of stuff. Is there anything else that we can do to be able to support a child? So say, for example, blood tests, because I know that is something that kind of happens quite often. Is there anything as the parents that we can be doing to support our kids with that if they're distressed?
Yeah, there's so many different things that we can try to borrow from what child life specialists do. Right now at the lab that I have to take my daughter to, they don't have child life specialists, or in the UK, play specialists. So they don't have that at our lab. But there are different resources. I want to say, what is it called? The Meg Foundation has some free resources and pamphlets and different things you can do, like a comfort position. So instead of the child sitting in the chair by themselves, they have the option to sit on their parent's lap, or there's different ways that they can sit that they feel more safe having that presence. And then there are tools like the Buzzy Bee, which is, have you heard of the Buzzy Bee before?
No, tell me about it.
Oh, it is so cool. So it is like a device that buzzes, and you have an option of a cold pack too. And the buzzing causes your body to release neurotransmitters that kind of block the pain receptors. So there's the Buzzy Bee that some labs have, or you could get off Amazon. There's, in this similar context, like an acupressure patch that you put on that releases the neurotransmitters. So there's different things that you can do to help with even their pain perception, or even they have, like Thimble Health has lidocaine patches now, where you can put a patch on where you're anticipating getting the blood draw and it'll numb the area. So there's so many different things that we can look at and try to advocate for as parents. And if the hospital doesn't have it, or the lab, wherever you're going, then a lot of those things you can purchase yourself as well.
Okay.
So that is, and then there's also like distraction, of course. So I do always want to preface that with we don't want to take an older kid and not let them know what's about to happen and then think that distraction's enough. I like to call it empowered distraction, where they know it's going to happen and they choose to watch something else anyways or look away. So with my 2-year-old, when I brought her in, I had Baby Shark playing, and I had her sitting on my lap. And she's quite young, but I told her what was going to happen, that she was going to have a little owie beforehand, and it might hurt, but that I'll be there. And she repeats after me, owie, hurt. So I think she knows, and she stayed still, but then it failed. So we're going in next time, and I have the lidocaine patches now. So it's all, we're doing our best, and we're all learning together.
Absolutely. And I think I remember going in and having various experiences. And I think that there's so much about the parent's nervous system as well, because you've been through so much too, right? And I remember there being times where medical professionals would be doing something to my child and I wouldn't be advocating, because I'd go into that kind of people-pleasing mode or whatever. And that is really normal, and then we beat ourselves up for doing that as well. But we have this idea of the way that we want to do stuff, but when we're triggered, that's really hard to do as well. So I'm just adding in that part of, if you've been through stuff like NICU, it might be that you're more heightened going into those situations as well. So pausing yourself, grounding yourself before going into those is really important as well.
Yeah, and I'm glad you brought that up too, in the people-pleasing aspect, because that is something that I've dealt with my whole life, is people-pleasing, and I am particularly frustrated by it, seeing how it affects, like, when I'm trying to advocate for my child, but then I'm like, I don't want to be seen as the difficult parent, and I think that's where we're trying to get more hospitals to put up posters and pamphlets that are reaffirming parents, like, it's okay to ask for things. It's okay to advocate. We want you to. And I even know that, like, being a nurse, like, I wanted parents to advocate and be involved because they know their kid best. But then when I'm the parent at the bedside, it's like I forget that. And I'm like, oh, wait. I don't want
I
them to
know.
be uncomfortable.
I know completely. It's so, so difficult. And sometimes you just do it automatically as well. It's not even a thought process. It's just like
Yeah.
it just automatically happens. But it's just that part of going, we're doing our best
Yeah.
within all of it. Right. And I think we get so wrapped up about doing this wrong because we don't want our kids to be traumatized and we don't want them to be affected by this. We don't want them to be distressed. So it feels like there's a lot of pressure there, I guess.
Yeah.
I'm just having a look at another couple of questions that people have said. So someone has said, we're doing at-home treatments. Our 2.5-year-old is due to start weekly IG transfusions. That's right. So, and I will have to give, and I want to make it as easy as possible for all of us. So other things that they can do at home to be able to make those treatments easier.
For preparing for treatments, I like there of course is the option where you can look into a virtual consult with a child life specialist or play therapist, so they can actually assess your child and like their understanding of it. 2.5 is quite young, but they'll still be able to give some really neat tips and in a coping plan of how to deal with it. If it's like the SCIG infusion where they have a home infusion pump, we do make a couple different options of those in toy form.
Okay.
So for that young age, it could be neat for them to see their stuffed animal with the exact same pump getting that infusion. So I think that that's something that could be really powerful for them is just the visual and being able. Young kids want to touch their own equipment and they want to play with the pumps and stuff. And we've had so many parents say that once they have the toy form, like that fills that need for them because they can be in control. They can push the thing, play with the stuff and play nurse. And that is everything for them and helping them get through their treatments.
Yeah. I guess there must be something quite normalizing as well for kids or allowing them to feel quite seen if their toys have the same things that they do as well. Is that a part of it that you see?
That's actually what we started with was trying to allow medical representation in dolls and stuffed animals. And then it started as we got better, honestly, with design, and started to get more educational and being able to teach with the tools. But the representation is a huge piece of it because any kid, like when even like my daughter, like anytime that there's like a Disney princess with her same eye color, she's like, hey, that's like me. So that's so important. Like we want to see our experiences represented. And my daughter has asthma, but she doesn't have to use her inhaler that often. But anytime she sees an inhaler like on TV or like in a book, she's, hey, it's like me. Like they get so excited that what makes them unique isn't like it's neat, but it's like they're not alone.
Yeah, completely. And I've had it with my son with the NICU stuff, like whenever he sees an incubator or like we are quite often watching Bluey, and whenever that Bluey early baby one comes on, he comes and he goes, I was an early baby, and talks about him being in the incubator and all of that. So I think just being able to, I would love to be able to have like an incubator that they could play with.
I know.
That's such a lovely idea.
That's been requested a lot, and it's bigger than what we've done before, but we're trying to brainstorm how we can make it work because I want one too.
Yeah.
I love playing with these toys just as much as anyone else.
Yeah, I love that. Okay, so we've talked about the blood tests one. Let me just have a look about. So how about things that maybe feel a little bit more bigger, a little bit more scary? So how to approach explaining about an upcoming surgery, maybe where they're going to be put to sleep. So something that feels maybe a little bit bigger. How would you go about talking about that?
In those cases, I really would recommend looking up if there are virtual play specialists, or even there's a lot that it's starting to happen more where you see them working in the community, like a private practice play specialist or child life specialist. And in those bigger scenarios, that's where it's really helpful to know what types of the process to talk about the going to sleep and how they're going to wake up, what to expect. So it's definitely something that I would want to, like, if my own child was undergoing surgery, I think that I would feel most comfortable getting a specialist to help with that.
Yeah.
If what to expect, what type of surgery it is, like if it's going to be like a external fixator, for example, like on their limb, like then seeking out toys for that type of stuff too to help process it. But that's more so going to be like processing it after the fact and maybe showing them what to expect when they wake up. But I think that a big part of surgical preparation is that pre-op area where they're going to get the IV or the sedation, anesthesia. Like, so I think that it's hard for a parent to try to navigate this. So I would say to look at resources and look up those online child life specialists that do have books available and
Yeah.
see. There's some on Amazon, I believe, even like preparing for a hospital admission. And so there are different resources they can get to equip them and then to get that tailored age appropriate support for your child, whether they've had medical care in the past or not, then seek out a specialist, of course.
Yeah, completely. And I guess there will be different resources if you're looking around YouTube videos. I guess there will be different kind of trusts that have done various YouTube videos. It might be that there are books and things like that to be able to recommend of books, things that you tend to use with kids in any kind of way or that you've come across to be able to help with kids.
Yeah, absolutely.
Yeah.
I know like Child Life to Go is one company where she makes books. And if there's anybody listening to this that's wondering if there's a resource for what their child specifically going through, they can always reach out to me and I can connect them. Like we have,
Okay.
being in this space, I've met so many people that are doing things to like help in this space of medical trauma and helping kids. So there's a lot out there and we're trying to create a space where it's easier to find the resources because it's so hard right now because everything is so niche. Like it's like for children with epilepsy, there's this resource and there's nothing like for everyone. So that's where if there's anything anybody's wondering about, they can reach out and I can connect them with what I'm aware of.
Amazing. That's really, really helpful. I wonder if this is maybe slightly different to what we've spoken about. So we already said if your child is distressed and what you can do in the moment. So if you are recognizing that your child is hesitant to go into the doctors or is already showing kind of signs that this person said, who is already traumatized, like they're kind of naming that about their kid. Is there anything else that we haven't spoken about that might be helpful to try and help them with that if they're having to go in for doctor's appointments, medical appointments, things like that?
Yeah, I'd say a big part of it is just trying to understand what it is about it that's making them feel hesitant and creating an environment where they feel safe talking about it. So I wouldn't do it the morning of a doctor's appointment, but just beforehand, in whether you have medical play tools laid out and you're just observing them play and see if there's something in their play where you can identify that they're saying is scary to their stuffed animal, or just opening up the conversation about their past experiences and trying, instead of being guided like, oh, are you scared when they do this? It's more so having them lead the conversation. So, hey, what do you remember about your last appointment? And just trying to just keep an open dialogue and see what that is. Because sometimes it's a misconception about something that happened. Sometimes it's something that was really scary. Like they had to go to an ER to get stitches and they're afraid now if they go back to the doctor, it means they're getting stitches. And you could say, oh no, that was done. That was. So I think that it's really important just to try to understand what is the source of the fear for them if you can get that out in a conversation that they're leading.
Yeah, completely. And I guess it's that part of letting them know that the scared feeling is a really normal feeling to have. Like it's something that's trying to protect you. But then I guess general kind of coping with that feeling, right? Of being like, there's things that we can do, like breathing, we can do it together.
Yeah.
The grounding stuff, you can do that together. Like just being able to be like, we're bigger than the feeling and we've got it together to be able to cope with it.
Yeah.
Together,
And my 6-year-old, when she gets nervous for things, it's something that we talk about is that, her body feels nervous. And I was like, but we're in charge. We can try to control our brain. So your body might feel nervous, but we can tell our brain, no, we can still do this. And she really likes that. And it's really funny because it's something that like I didn't learn till just a few years ago, the difference between the nervous system, like body and brain. And I'm trying to work through that concept myself. And when I tell my 6-year-old just on a whim to see if it would help her at the shift, she was like, okay. She like understood it. And and this was before a school like play. And she like went up there and did it. And I'm like, how did that work so well?
I know.
That's it better than I do. But
I know. Yeah. I do think our kids are probably better emotionally than we are generally.
We're too far gone now.
Yeah, completely. But just thinking about this kind of stuff that you would do in the therapy room. So the kind of things that I would do are like externalizing the anxiety or giving it a name or giving it a persona, or people talk about Inside Out, for example, right? You know how they have all the different characters and stuff like that. Being able to allow people to go like, this is anxiety, and it kind of, it comes towards me whenever we're going into a medical setting, but being able to externalize it a little bit so that we know what anxiety means and being able to react to it in that kind of way. And I guess you could do that with play as well, right?
Yes, I love Inside Out. And I think that that's like such a perfect example of externalizing it too.
Yeah, totally. If anyone knows me, I always bang on about Inside Out. It's brilliant in terms of being able to talk to kids about those different emotions. But I guess that it's all about kind of putting it outside of the kid. The play, the play with the medical equipment, the toys, the stories. It's all about allowing the kid to be able to kind of pull back a little bit and to be like, this is the experience. I'm able to see it outside of myself rather than it feeling tangled and scary and within them, right?
Right. And yeah, it gives them an outlet in processing like what they've gone through and trying to make sense of it. Honestly, that's really them. Yeah. Their play is often reflecting reality because they're just trying to make sense of the world around them.
Yeah, exactly. Is there anything that I haven't asked you that you think is important to cover before we wrap up today?
That's a great question. And I feel like I could talk about this all day. So I don't think that there's anything specific.
Okay.
Yeah, whoever is listening to this, if they're going through something and they're trying to figure out how to support like a NICU sibling or a child and like a NICU baby later on, like I am more than open to connecting them with resources because I don't want them to ever feel like they're alone in that. And if they want to explore like how play could help them, I'd be happy to connect them with resources and people and other ways to start navigating that road.
Incredible. We'll put all of your information in the show notes so that people can get in contact with you. Is it best to do that through Instagram or your website, or how is best?
I would say Instagram that one's monitored. I have someone that helps me look at those messages too. So then they flag whatever ones are specifically for me. So Instagram is probably the best way.
Wonderful. Lovely. Thank you so much for your time today. It's been so helpful, and we will send people your way because what you do is brilliant. And I just loved it when I came across it. I just absolutely loved everything you do. So thank you so much.
Thank you.
Thank you. All right. Well, take care. Speak to you later.
All right. You too.
Bye.
Thank you so much for listening to the NICU Space podcast by Miracle Moon. If this episode resonated with you, please know that support is available and you are always welcome in our community. If you found this episode helpful, one of the best ways to support the podcast is by sharing it, leaving a rating, or subscribing. It helps these conversations reach more NICU parents who really need them. You can also find us on Instagram and across social media at Miracle Moon UK, or explore more resources at miraclemoon.co.uk. Wherever you are in your NICU story, please remember this: you are not alone.